Today on Let's Wrap.
Just trust the process of going through life living with this disorder and being a part of the bleeding disorder community.
There's always going to be bumps in the road, but you're going to get there. We're going to look at everything that we can do because of hemophilia.
Tyla Folks, clinical educator for HPC, and her son Zach have a lot of life experiences when it comes to bleeding disorders. But they use those experiences to help others both personally and professionally, and talk about what inspires them and how they inspire others with good vibes for life. Joining us today on Let's Wrap, Tyla Folks, clinical educator, and her son Zach. Thank you so much, both of you, for joining us today on Let's Wrap.
Thank you for having us.
Mm-hmm.
Well, Tyla, I'll start with you on, I know it's been a journey for your family. And can you take me back to when, I guess, bleeding disorders first became a word you were even, familiar with?
Well, to begin, my father had severe hemophilia, so obviously it ran in our family. He would teach me a little bit about it when I was younger, would see him infused at the kitchen table. He contracted HIV due to blood products that were tainted, and did pass away when I was a teenager. So kind of lost that connection for a lot of years. But then I had Zach, and he was my first, and he was diagnosed at birth with hemophilia. So we started out there. Luckily, I was already in nursing school, which has obviously helped a whole lot throughout this journey. And then we also have a 15-year-old that was diagnosed at birth as well. So that's been how it's gone in our family throughout the years.
And Zach, I know you don't remember, obviously, it's been a part of your life, your entire life. Can you talk a little bit about just how you've learned to deal with it, how it's kind of shaped who you are today?
Yeah, so I mean, I guess growing up, it's harder as a kid dealing with things like this because you can't do everything that all the other kids can do, whether that's like playing at recess or playing football, like playing certain sports. But I think I just sort of found what worked for me. Like I played baseball my whole life and was always active. And I think it definitely helped having a mom that was so involved and knew so much about it already. But it's also just sort of taught me like how to like do things on my own, like growing up and going into college and stuff and learning how to like care for myself. And it just sort of like lets me be better on my own because I'm so prepared having to constantly keep up with like bleeds, medication, all that stuff. So I think it actually like helped me like learn more about life growing up. So
Definitely. And Tyla, when did you first start working with HPC? It seems like such a natural fit and place for you, but how did you become acquainted?
Well, a really good friend of ours, Tim Andrews, came up to me one day at an event we went to with HPC, and we talked about me being a nurse, and he's like, "Hey, can I talk to you later?" So he called me up. We talked about HPC, and he said, "I have a need for nurses with hemophilia experience. I know you've got the boys, so it seems like a natural fit. Seems like something that would this be something you're interested in?" And it was at the time I'd worked in the hospital the whole time, my whole career thus far, and it just had a lot of thinking to do about it, and then ultimately realized, hey, I can give back to other families, not just professionally, but on a personal level. And if I had that when Zach was growing and was younger, then that would have been wonderful. I would have been very thankful for that. So that's how I came to realize, yes, this is the right thing to jump into. So, and it worked.
And I'm sure there have been so many patients over the years that have appreciated that you've been through it. And so, maybe not exactly what they're dealing with, but have very similar shared experiences.
Oh yeah, for sure. I've worked with a lot of new moms And that has helped them to know. I worked with one, and we are also involved in the local community as well. So just as families, we became friends at our local events, even outside of work. And so our kids, look, my younger child, they got to know each other and be friends as well. So there's just so many layers to it. And also, but worked with a lot of new moms, and they really, appreciated everything that I did to help them. Would just hug my neck and just say, "Oh my gosh, if it wasn't for you, I don't know where we'd be, right now," which means a lot. So yeah, and I have worked with all ages, of course, but that's where I've kind of, where I've shined, so to speak. So
It's emotional for you to talk about.
it is. I've always loved doing it, and I've always said any way that I can give back, I will. So.
Zach, how proud are you of your mom? You've seen, her help you and your brother, and then how she's used that knowledge that she gained at home to help others.
Yeah, I know it's done a whole lot for me, because I know if I would have been like on my own and she wouldn't have known anything about it and just sort of been diagnosed with it, I think I would have definitely grown up a lot different. And because how hard it is to advocate for yourself and to understand everything that is like brought into this, like with the treatment, talking to doctors, all of that, and then obviously she does that with my brother and lots of other patients, and I know it definitely changes their lives too.
And Zach, can you tell us a little bit about what you're doing now, what your future plans are?
Yeah, so I went to school at the University of Memphis for my undergrad, and I graduated there with a degree in exercise science. And then I decided to come to the University of Miami to get my master's in exercise physiology. And now I'm working with, I was just with the University of Miami football team, interning with the strength and conditioning staff. And now I'm going to FIU, which is it's the Florida International University right down the road. And then hopefully after this summer, I get a job as a strength coach for either like a college professional team, or just going to like a private sector job with that. So
Definitely. Yeah. Do you foresee any intersections with working, with those with bleeding disorders in your future plans?
I feel like it could be possible, because I know with what I've done with like physical activity and how I've seen, because I've had like a really bad elbow issue and had to have surgery. That's where I had all my bleeds growing up, so it was really bad on that, and I have like severe arthritis in it now. And I know being so active and keeping like the muscles built up around the joints has actually helped, like more than anything. I think keeping my bleeds low, rarely having those. My elbow's gotten a lot better, just from keeping it so mobile and active. And I think maybe if some sort of program or something needs help, I could definitely see myself doing that in the future.
And I think definitely sharing your story where you are today can definitely be an inspiration.
Yeah, definitely.
Tyla, you've had an eye on this for not just with your own family, your father. So you've kind of seen the progress in the treatment of bleeding disorders, how it's evolved. What do you think maybe has been the biggest breakthrough to help those who are dealing with a bleeding disorder and enabling them to have a better quality of life?
Definitely starting on prophylaxis therapy, which is regular scheduled factor infusions. That has made a huge difference. I saw a difference in treatment from the time Zach was little to the time our youngest son, Will, was little. Just even, they're 9 years apart. So even in that amount of time, Zach was mentioning his elbow. They didn't start prophylaxis or earlier on with young kids his age until they already started having a problematic joint. Whereas Will, they start pretty young. They went ahead and started before they had a joint that was bad. So obviously that affected Zach differently, much differently. Even with the older generation, that helped their joints to even feel better, where they could be a little bit more active as well. Even though they already had some bad joints. So most definitely, I think switching from just a therapy where you're just infusing when you have a bleed to proactively infusing scheduled is definitely a big step. Was.
Well, and that's encouraging to hear you talk about, maybe when a new development takes place, even those that maybe didn't have that opportunity, when they were younger, it can still benefit them even later in life. That's great to hear.
Yes, for sure. Absolutely.
Zach, do you have much perspective on throughout your life, anything that you really noticed, like, oh, this is different, or this has really improved and helped with my quality of life?
One thing that I've noticed is like the difference in like the treatment centers and how those have grown and sort of changed, and especially going from as a kid going into that one, and then as an adult care, and the difference in like how they treat you, everything that you're exposed to with the doctors, having to do it on your own. I would say that it's sort of gotten to where it's a lot easier now for me to do it rather than how it used to be. Well, of course, I had my mom helping me, but not everybody has that, and I know it can be hard. So seeing that evolve and change and get better for me, I know that's one thing that I've noticed.
Definitely. And we've just been, through a pandemic, a couple of years. It still really isn't completely over, but things have improved. But how has that impacted both of you, or has it from a standpoint of dealing with a bleeding disorder, and any additional things you could or couldn't do as a result of the situation?
Well, for me, I know one big thing is having to go virtual with appointments and not being able to see like the doctor actually in person as easily. And because I know I still have issues because I am so active, I'm going to have little aches and muscle pulls and strains and whatnot. Um, and being able to see somebody in person is really important for me, to actually know if it's a bleed or if it's not. And it's gotten a little bit better now, so I'm able to see them more often. But I know it was for a while at the beginning, you couldn't really do anything.
And Tyla, what about you?
I was actually going to say the same thing, to be honest. But I can also put that on a professional level too. Now, obviously, when patients need something and they need their infusions and so forth, the nurses still go out and infuse those patients. Now, it's looking different in the way of masking up and so forth, and having to ask corona questions prior to the visit and so forth, and making sure no one's sick in the home and that kind of thing. But even just professionally, we can't like get together in person as much as we could. It's starting to obviously move back a little bit, but it's a lot of virtual Zoom meetings and so forth, which can get a little isolating and so forth as a work environment too. We try as much as possible to get to do fun things virtually, or that, different things. But ultimately, a lot of people are working from home that we're not, and except for our essential pharmacy staff. So that's a little bit of a change, but definitely the virtual visits with the physicians, that is a change. Even now, I actually just went with our younger son yesterday to his hematologist at St. Jude for their visit. Well, we're limited on visitors, so my husband can't come as well. It's just me, or one of us. So it was just me. We had a brand new nurse case manager, so he can't meet her, just me at this point. And of course, we were swabbed for COVID, screened for COVID, all of that stuff. So there's a much higher level of even getting in to see the physicians too. So
definitely. And I know telehealth has become very popular, but I'm sure there's still some things that can really be determined in person that you can't do virtually.
Right. Well, like Zach was mentioning, when he has different problems with his joints or muscle or injuries or what have you, it's very difficult to evaluate a joint or evaluate a muscle virtually. I mean, you can talk somebody through some things like measuring the joint, if they're even able to do that well, or if they have a tape measure. You can go through all the symptoms, you can show them something, but it's not always in hemophilia. It's not always something you can see outwardly. A lot of it is inner, where you can't see it unless it's really bad. So that assessment that really needs to be physically there is very difficult. So
Yeah,
you
like
would just
with the issues I've had lately, where I have to go in and get an ultrasound done on that area to be able to see if there's blood in it. So, like, I
Yeah.
wouldn't be able to do that virtually. I don't have an ultrasound machine at
Right.
home. So,
Right.
yeah.
so true.
Zach, I know there's several years between you and your younger brother, but can you talk about when you both have a similar, condition, how does that, how does that maybe change the bond that you have as siblings?
I think it definitely like makes a stronger bond as a brother, because this is something difficult growing up with, and to be able to, I think it helps like being a little bit farther apart in age, because I'm able to go through it more and understand how to take care of myself, and then show that to him if he has issues growing up, and it's something that you just live with, but you always stick together with it.
HPC's sort of motto is good vibes for life. I'd like to ask each of you, when you think about how you've been challenged with hemophilia, is there something that you always try to tell yourself and others to encourage them and give them that good vibes for life feeling?
Well, I'll start. The way I look at it, and the way I've told the boys, when they were really young and questioning things, or just looking at it overall, and with new families, it's like, okay, there's always going to be bumps in the road, but you're going to get there. We're going to look at everything that we can do because of hemophilia. Look at the experiences we've had, looked at the people we've met, such as camp and all their buddies from camp, or different events with HPC or with our local foundation. Some of my dearest friends in the world are through the hemophilia community, and I can't imagine them not being in my life. And I just say to younger families, hey, I've got a 24-year-old and a 15-year-old who have survived so far.
Right.
So it's okay. But always remember, we still have our moments, but again, just bumps in the road, but we'll get there.
And what about you, Zach?
I would say one thing is just to be patient and sort of just trust the process of going through life living with this disorder, and being a part of the bleeding disorder community, and always reaching out and participating in things, and taking care of yourself, and really being involved with your treatment centers, your doctors, and just know that everybody's there to help you, and don't be afraid to ask questions, and just trust yourself that you can take care of yourself, and that it will get better if anything goes wrong.
Is there any kind of upcoming treatment, development, breakthrough that you both maybe have your eyes on or you've heard about that you think could be the next, life-changing opportunity for those dealing with a bleeding disorder?
They are working on gene therapy. And from what I'm reading and hearing about, and the studies I've read, they are getting closer to that. It's a very difficult thing to make. Obviously, gene therapy it is what it is. It's difficult. They've been working on it since before Zach was born, possibly.
Yeah.
But they're getting a lot closer, and that is extremely wonderful to see happen, and great news for my kids in the future, hopefully.
Definitely.
Yeah, I was going to say that exact same thing, because I know there's a lot of different stuff, but the way I've sort of done it is that if it's working for me, I don't want to really change it or risk doing anything different. But I know that gene therapy is something that I have been told about, and that I'll probably look into in the future when it does get more developed and is ready to actually use. But other than that, I just that's pretty much it.
Right. And Tila, your role, I know you've had several roles with HPC, clinical educator. Is there a common question, as an educator that you always find is that's something everybody, asks me, or even a couple kind of themes that you hear that might help listeners?
I would say younger kids. So the younger families, they'll say, what is my child going to be able to do?
Right.
Physical activity wise. That's always something. You may have you have dads out there that want their son to play football, you know, right off the bat, and then they learn, oh, we may not be able to do anything, and they're like, what are they going to be able to do? What do we need to do around our house to protect them? Of course, we always refer to their physician, their hemophilia treatment center. And but I just remind them, always give them the big no-nos. Football is the biggest. Hockey, if they live anywhere near a hockey team or area. But that I always remind them that they don't have to put their child in a bubble. There are going to be activities that are recommended, some that are not, some that are possible, but may be a little iffy. But don't put them in a bubble. They can live a life with hemophilia, and it's okay. And they can, like Zach has mentioned, building up those muscles around the joint. So being physically active is really important, and that's something that the community has seen over the last years. So it is important to do something. I would say that's probably one of the biggest things. And then, of course, learning, when can we learn to infuse our child, so that we can have some independence. We don't have to worry about, wanting to have a nurse in our pocket at vacation,
Right,
sort of thing. And, I just reminded them, and all of our nurses at HPC, do this, is we want our patients to be as independent as possible, as soon as possible, because that will give them a, large feeling of accomplishment and freedom. So yeah, that always remind them that is possible, and we'll get them there.
And Zach, do you find when you maybe are talking about your situation, is there a common question or two that seem to come up a lot with people who maybe don't know much about hemophilia?
I would say one thing I've definitely had to deal with is like roommates in college, and them seeing like my like factor bottles and syringes and needles and stuff, and they're thinking I'm like doing drugs or something. Um, and then I had to explain that obviously, but once they know, it's not really a big deal. But also just like having a bleed, they don't really understand what it is. They think, oh, you're hurt constantly, but you don't realize that like you just take care of it and it goes away in a few days. But um, really letting people around you know like that, explaining sort of the process and how dangerous it could be, so people know like what to do in the case of an emergency. I've always had to explain that a lot, but so far, every experience I've had with that, everybody's understanding and really helps take care of me when I need it.
Definitely. And for both of you, if there was maybe, I guess, one wish or one thing you'd like to see when it comes to medical developments, what would that be?
Um, I guess I would say gene therapy.
Sounds promising.
Honestly, because we've got a lot in treatment areas now in the way of factor, and like Zach mentioned, ultrasound, a lot, different ways to diagnose bleeds or issues with joints. So, I mean, I think the next big thing is going to be gene therapy. I would love to watch my kids grow up even further without having to worry about taking factor on a regular basis.
I would say, besides that, that is one big thing for me because I do have to take factor, but it's not difficult for me to take the factor constantly. But along with maybe not having to do IV infusions myself, something like a muscle shot or however they do that. Um, and also like somehow to fix damaged joints. I don't know if that's directly related to hemophilia, but I know there's no options for me at my elbow. Uh, I don't know. I don't know how long that would take, but I would take a new arm if I could. So
Yeah. Well, is there anything else you would like to add today as we're chatting?
I'll just say, it's like I said earlier, for other families, just remember to get out there, educate yourself as much as you can, and don't be afraid of it. It's just a part of your life. It's not going to don't let it control your life. And that both of my boys, I'm just extremely proud of, and can't say that enough. And now I will start crying again. But no, I'm extremely proud of them and the relationship they have and how well they take care of themselves. So
I can
they're
see
awesome,
that.
awesome
Yes.
kids.
I would say just to anybody that has a bleeding disorder, just don't be afraid to go live a normal life or to take risk and like move across the country by yourself if you really want to. Just know that there's always going to be like a good group of like the treatment center that's going to take care of you, and then people around you. Just don't be afraid to like advocate for yourself and to really look into like how your treatment plan and how your doctors are taking care of you, and just live a normal life.
Yeah. Well, it's great to see both of you and share your knowledge, both personally and Tyla, your work with HPC. And I think that people can learn so much from both of you, and you're both just very inspiring in helping them live their best life and know that there's a lot of things that they can, still do.
Thank you.
Yep.
Well, thank you so much, Tyla Folks and her son, Zach, for joining us today on Let's Wrap.
Thank you so much.
You've been listening to HPC's Let's Wrap, a podcast by HPC Specialty Infusion for patients and providers. We're proud to specialize in patient health and happiness at hpcspecialtypharmacy.com or call 1-800-757-9192.